Hi, I'm Marie, and I'd like to welcome you to Spanish for Healthcare Workers. I want to congratulate you for taking this step in learning the Spanish language. This tape will focus on the basics of Spanish, and then we'll expand to Spanish that is relevant to the medical profession. As you know, in the medical profession, situations occur so rapidly that knowing the right word or phrase to say in a patient's native language can be helpful in preventing a crisis. Please note that this is a brief video, and it is not intended to promote fluency. Rather, it will help you learn terms and phrases that will benefit someone that is a Spanish speaker. The best way to benefit from this tape is to practice it regularly. Repetition is the key to memorization. If practiced properly, this tape will give you the skills needed to perform effectively in Spanish. Repeat each word or phrase after I say them. I will encourage you to do so by saying repita. In the basics, we will cover the alphabet, the numbers, the days of the week, the months of the year, the seasons, and the colors. So sit back, relax, and enjoy. Now, the basic building block of any language is the language's alphabet. But in a healthcare setting, why do you suppose it would be beneficial to know the Spanish alphabet? Yes?
To put our patients more at ease?
Definitely, that would be beneficial. Anyone else? Yes?
That you can possibly write down, maybe, or they can write down for you what you don't understand, and you can read it.
Definitely, because you may encounter a situation where a patient's unable to speak, in which case they may resort to writing it down on paper. And in that situation, it would be very beneficial to be able to read it. Anyone else? Yes?
Whenever you learn English, you begin with the alphabet. So whenever you learn Spanish, you should begin with the alphabet too.
Definitely. And with that, we will begin with the Spanish alphabet. I'd like to present it to you right here. As you can see, many of the letters are the same as the English alphabet. However, the Spanish alphabet contains 30 letters. So I'd like to introduce to you the 4 extra letters that we find in the Spanish alphabet. The first is a CH, pronounced simply like a CH sound. It's known as che. Repita.
Che.
Very good. The next is eye. That's a double L, and it's pronounced similar to a Y. I'd like to show you this letter in an actual word. We may be inclined to think that this says calle, but actually in Spanish it's pronounced calle. The eye is right there, and calle means street. So this is eye. Repita.
Eye.
The next letter is ñ. It's an N, and above it is what is known as a tilde. It is pronounced like an NY sound, ñ. And this can be seen in the word for girl or boy. This is pronounced as niña. So this is ñ. Repita.
Ñ.
Very good. And the next is a double R known as R. And when you see the double R, that's an indication for you to roll the R. However, I am aware that there are people that are able to do this and people that are unable to do this, and that's okay. There's no pressure to pronounce the double R. You'll still definitely be understood. So we have che, ella, ñ, and R. Also, it's beneficial to know the Spanish alphabet because it will aid in better pronunciation of the Spanish language, facilitating anyone to be able to understand you better. So I'd like to show you some basic general rules in the Spanish language. In Spanish, it is a very phonetic language. In other words, everything really is pronounced as written. That's what makes it very simple to learn because we know the same does not apply to English. And one thing